Well, the University of Kentucky carefully selecting 72 people this month and offering them a drug called EvuSheld. It's the monoclonal antibody treatment that offers protection from COVID-19. Those doses reserved for patients who are severely immune compromised. Evening Edition's Kristen Edwards talking with one woman who got the drug about how it's impacted her outlook on the pandemic.
In 2016, Lexington mother of two, Sarah Lister, was diagnosed with leukemia and had a bone marrow transplant. Since then, her body has continuously rejected the transplant. To counteract that, she has to take immunosuppressants. That's good for her transplant, but bad for fighting viruses like COVID-19. Because of those immunosuppressants and other treatments she undergoes, the COVID vaccine was ineffective for her.
That was a huge disappointment because that was the thing I was hanging my hopes on.
Because it didn't work, she was forced to continue quarantining at her home with her family, terrified of the virus. Then UK called, saying she was selected to get a drug called EvuSheld.
When they called, I said, I will be there in 5 minutes. Like, just hold the needles in the air and I will come run into them when I get there.
The monoclonal antibodies in the drug will increase her immunity against COVID for at least 6 months.
We are all very, very excited about this drug.
It's something UK physician Dr. Ashley Montgomery Gates calls a game changer for people who are severely immune suppressed.
It will just eliminate some of their risk and their fear. It means that they have less of a chance of ending up in the ICU on a ventilator, which I think is huge for some of them.
Since it isn't a silver bullet, there's still risk. Risk, she says, that would be mitigated with widespread vaccination, further protecting our severely immune-suppressed population like cancer and transplant patients.
These people are doing everything right, and because we have this huge unvaccinated population that's still spreading the virus, they are the ones that are getting the brunt of it.
As more people embrace protecting themselves and their families against COVID, you will be then helping my family get back to society.
Back to a life where her 9-year-old and 14-year-old can play with other kids without worrying they'll bring the virus home to their vulnerable mother. Back to a life where Lister and her husband can go on a date to the movies or a restaurant. But until then, she's trying to take care of her mental health and stay positive.
I just continue to believe that there are better days ahead. And until we can have our better days outside of the home, we're just doing everything we can to have those better days inside the home.
In Lexington, Kristen Edwards, Evening Edition.